I hope now, is it okay? Am I audible now? Okay, wonderful. So, hi people, good evening, everyone. Good evening for you, but let me tell you, it is a good morning for me. This live class is going on from the other part of the globe itself. I am sitting right now in Calgary, Canada, and I'm exactly my timeline is opposite. So it is morning, 5:36 a.m. and for you it is somewhere around 5 I think, if I'm not wrong. Okay, I've although I've set my watch according to the Indian time, but I hope that I'll not look sleepy to you. Sorry, there's no green screen here, so the resources that I have, it is at your disposal. Okay, okay. I think the resolution and all everything is fine. I mean, some people are talking about the resolution and all. I'll not be looking too much into the messages because if you just keep looking into the messages, then you just get carried away. What I'm going to do is, guys, let me just give you the plan that how we're going to go about it, and after that, I request you that not to bombard the group with the messages. I will not take too much of doubt in between because if you take somebody's doubt may not be someone else's doubt. So that's why what I'm going to do is okay. Yeah, please let's not talk about the resolution, how the resolution is and all. As I said, this Telegram thing is also very distracting also. So I'm not gonna look into it further, as I already got the feedback from you that audio and video is coming fine. So let's get on with it. Well, guys, first of all, once again, good evening to all of you. And what I'm gonna do is let me just give you the plan that how we will proceed to this anatomy part for the upcoming days. The class is scheduled in such a way that we are taking this classes like for you it is like somewhere in the evening to like around 9:30, 10 o'clock for me, which is exactly opposite. Most of the time, uh, I think it will be like will be two sessions will be there, around 2.5 hour session, and then we'll have a break in between, break of around 20-25 minutes in between, and then we can have the second session. So you probably already got the plan that how we're going to go about this. I think the first session is open to everyone, but the people who are like attending this class with me for the first time, let me just tell you the plan that how we will proceed into it. Well, guys, I'm not telling you day wise. I'm just telling topic wise. We will start our discussion in the anatomy with the head, neck, and face. Well, right, head, neck, and face, which is going to be our first topic. And there is a reason for the sequence here, which you will eventually understand that why we are choosing such a sequence and to go in that manner. After head, neck, and face, guys, we will go to the neuro anat because there are certain topics we'll discuss in the head, neck, and face which will be used heavily in the neuroanatomy part. So that's why neuroanatomy should be followed by the head, neck, and face. So according like what I'm going to follow in here. After neuroanatomy, I will take care of the embryology. So embryo is a third thing that I'll discuss here. Again, something that we discuss in head, neck, and face, the cranial nerves and all, they will be used in the embryology part, and you'll understand that. And I'm discussing embryology before the viscera because there are so many things we'll discuss in the embryology which will make sense when we'll discuss the thorax and abdomen. Like they'll become a little easier. And let me tell you that out of from we still have to talk about the topics here. Head, neck, and face, neuroanatomy, and embryology. Well, this is the heaviest thing which is asked in the exam. Maximum questions in the anatomy, directly or indirectly, clinical, non-clinical, whatever kind of questions are there, they're usually targeted to these three topics here. So if you want to score well in the anat part, you have to have a good hold on these three topics, and that's why we are also going to give maximum time to these topics itself. Okay. After that, after embryology, guys, we will switch to the limbs. So we'll start with the upper limb and then lower limb. That will be the sequence: upper limb and lower limb. And after the limbs, then finally we will talk about the viscera and some discussion on the general. The viscera and general will be discussed at the very end itself, right? The viscera, sorry. Okay. So So this is how our approach would be in the innate part here. It's not that the upper limb and lower limb are not important. Obviously, there are a lot of clinical questions asked from this, and especially a lot of clinical questions being asked from the upper limb and lower limb part about the fractures, about the nerve injuries. So I'll try to cover up the nerve and nerve injuries for you, which is obviously overlapping with the ortho part, but we'll take care of that. Viscera is something you got to be really, you need to be really smart when you read the viscera. Viscera can be very tiring. It can go endless. Uh, Thorax and abdomen, you need to pick and choose and read from there. Like if I talk about any viscera, then you need to know that, okay, what relations I need to read for that viscera. Like recently, there was a question on the relations of third part of the duodenum. So we need to understand that why particular relations are being asked here. There has to be some surgical relevance, some importance to that relation. So that is my job to tell you, okay, that this is the kind of relation that you need to read. Not like the first day that we need to read about every superior, inferior, anterior, posterior, like that. So we will be really smart in this viscera part. Will dedicate less time to the viscera, but we'll try to extract maximum out of it. Okay. So without a further ado, guys, let's start our session. As I was told that today is the first session is open to everyone. I think it is open on YouTube for everyone. So welcome all of you people the one who are not the registered student with us and they're attending the first session. So you're all very very welcome. Okay. So as I said, without a further ado, let's start with the our first topic, that is a head, neck, and the face. So let's start with the one thing which I want to tell you right in the beginning itself, and this is something which I really really want all of you to follow here. No handouts. Do not rely on any other written material. If you really want to learn anatomy, you want to see, learning and remembering the two different things. Like once you understand the concept, fine. You When you look at these lectures, I'm pretty sure you'll be able to understand the concept here. But will you be able to retain them? That depends upon whether or not you're like listening to this one humble request of mine, that please write down your own notes. I'm not going to give you any handouts or anything. I will give you whatever slides I'll show in between, whatever images I will show you in between. I'll give you the soft copy of those images for sure, labeled images, high definition labeled images you'll get sequence wise according to topics only. So that I'll give it to you. No worries about that. Let's say if I show you something in between, some new image in between which is not there in the revision slide. So my usual habit is I'll take a snapshot of my tab right away and I'll send this picture in the break time into your group itself. So don't worry about any handouts and all. You don't have to take any snapshot from any tablet or anything. I'll do it for you. I'll send you all the pictures, but don't expect that you will be able to remember anatomy if you are having handwritten notes in your hand, because I need you people to anticipate certain things when we discuss them, and anticipation will come only when you will just write with your own hand here rather than looking at the notes which are already there in front of you, right? So guys, let's go. Okay. So in head, neck, and face, now the way we start the head, neck, and face everywhere is that they start with the scalp. The first thing that about the scalp, and then the face, and then about the triangles of the neck. But I'll take a little different approach here, and I'm pretty sure that you'll appreciate this approach a little later. We'll not start with the scalp, guys. We will start with the first of all the cranial nuclei, cranial columns, which is more of a topic of neuroanatomy, but we're gonna start with that only. Then we will go to the cranial nerves. We'll discuss all the cranial nerves here. In fact, our today's entire session will be about the cranial nerves, parasympathetic ganglion. And it is such a heavy loaded topic that with the cranial nerves, you'll be knowing a lot about the head and neck. We will be done with the nerve supply of every gland, every muscle, all the parasympathetic ganglion, the parasympathetic outflow will be done. So there's a lot which will be done with the cranial nerve itself. And cranial nerve is such an empowering topic that once you understand the cranial nerves, this will really really help you in your ENT and ophtha part as well. So guys, let us start with the cranial nerve nuclei and columns. Sorry for my wobbly handwriting in the morning, right? I just woke up. So cranial nerve nuclei and columns. Okay. Now, to understand the cranial nerve nuclei and columns, we need to start with some basics here. The basics here is, like, first of all, pharyngeal arches. Now, I'm sure you all know about pharyngeal arches, and I don't need any detail of pharyngeal arches. I just want you to think about pharyngeal arches, how many pharyngeal arches we have, and all that. So, let us say the pharyngeal arches. Well, guys, we have six pharyngeal arches initially, and the fifth one disappeared. So, we have first, second, third, fourth, and the sixth arch. So these are the arches that we have: first, second, third, fourth, and the sixth arch. First arch is supplied by the mandibular nerve. Second arch is supplied by the facial nerve. Third arch nerve supply comes from glossopharyngeal, whereas fourth and sixth arch, both fourth and sixth arch, they're collectively supplied by the tenth nerve, the vagus nerve. They're supplied by the tenth nerve. We don't have to go into the detail of that which branch of vagus nerve as of now. So it's the mandibular nerve, which is a nerve for the first arch. It's the facial nerve for the second arch. Glossopharyngeal is for the third, and the vagus nerve is a nerve for the fourth and the sixth arch. Okay. If you just think broadly about that, what are the muscles which are supplied by these nerves? Like we all know that mandibular nerve, it mainly take care of muscles of mastication. Muscles of mastication will come from the mandibular nerve, supplied by mandibular nerve. Facial nerve supplies the muscles of face, or you can say muscle of facial expression. Muscles of face or facial expression, that is by the facial nerve. Whereas the glossopharyngeal nerve and vagus nerve, once again, if I talk collectively about them, they are going to supply the muscles of palate. They're going to supply the muscles of pharynx and even larynx also. Muscles of palate, pharynx, and larynx. Now, this is what is done by the glossopharyngeal nerve and vagus nerve. Now, I want to take your attention to this point here, that right now we're talking about pharyngeal arches. You'll be like, why we are talking about pharyngeal arches? Our topic is cranial nerve nuclei. तो ये कहाँ चले गए pharyngeal arches में? Well, if you look at the muscles which are supplied by the nerve supplying pharyngeal arches, like muscles of mastication, muscle of facial expression, muscle of palate, pharynx, and larynx. Now you'll notice something common about these muscles is that all these muscles are the skeletal muscles. All these muscles are skeletal muscles, muscle of mastication, facial expression, all these palate, pharynx, and larynx muscles, these are skeletal muscles. If a question is asked to you that what are the types of muscle we have, then you will say we have a skeletal muscle, we have a smooth muscle, we have a cardiac muscle. A simple straight question. But you only think about head and neck part here. Now, just for now, forget about everything else. Just think about only this area, only this head and neck area here. Now, what are the types of muscle we have here? Then you will say we have two types of muscle here. We have a skeletal muscle and smooth muscle. Well, guys, yes, we have two types, skeletal and smooth muscle. But when you think about their development, when they think about their origin, that actually we have three types of muscle in head and neck also. Three types. Now, obviously, there is no cardiac muscle there. Then how can we have three types of muscle in head and neck? We have three types. One type is right in front of you. Now, all these muscles of mastication, facial expression, palate, pharynx, and larynx, these are the skeletal muscles, but these skeletal muscles are derived from pharyngeal arches. So we call them pharyngeal arch skeletal muscle. So that is one group, pharyngeal arch skeletal muscle. Remaining skeletal muscle in this area are derived from something called as somites. We'll discuss somites in the embryology part. So we call them the somatic muscles. Abhi, you have to think about that. What are the muscles left? Just think about this area. Just let's not go beyond this. What muscles are already done? Mastication is done, facial expression is done, palate, pharynx, and larynx muscles are also done. So in this area, the muscles which are left, which are skeletal muscles, are extraocular muscles and tongue muscles. Extraocular and tongue muscles, and these muscles are derived from the somites, and that's why we call them the somatic muscles in the head and neck area here. So that's an important point to remember first, that when it comes to the muscle, the somatic muscles. Somatic muscles are extraocular muscles and tongue muscles. Right. So my point is that there are three types of muscle in head and neck also. Developmentally, if I talk about, there are three types of muscle in head and neck also. We have, as you can see, we have these all these muscles that we just wrote above. These are the muscles derived from pharyngeal arches. So these are pharyngeal arch skeletal muscle. The muscles coming from somites, these are somatic muscles, the extraocular and tongue muscle. And then obviously we have a smooth muscle. Smooth muscle will be there like sphincter pupillae and ciliaris and all that. All muscle will be there, right? So if you have three different type of muscle to be supplied, then obviously the nerve, the columns which we need in the head to supply the head and neck muscle are also three type here. I'm sure you there's a really recent question only in the INI exam about the cranial nerve nuclei column which are present in the floor of fourth ventricle. You have to arrange those nuclei in the floor of fourth ventricle, like general somatic efferent, special visceral efferent, general visceral efferent. Now the point is, first we need to understand their meaning, then we need to understand what sequence they are present in, and then we need to know that what nuclei will come under them and what nerves will be related to them. So this is the target. That's the first thing that we need to achieve in this first session here, that to understand the cranial nerve nuclei and column. Now, first, guys, I hope that you understood this point, that we need at least three efferent columns or motor columns. Why do we need three efferent columns? Because we have three different type of muscle to be supplied. We have what muscle? Extraocular and tongue muscle. That is one group. The group of muscle supplied by this is coming from somites. Then we have muscles coming from pharyngeal arches, and then we have smooth muscles. So to supply three different type of muscle, we need three different type of columns. Now the question is, I have to go into these certain basics, because sometimes these basics are not clear to us. What do you mean by column? When you say the word column, column is basically arrangement of all the same kind of nuclei in one line. Like one example, extraocular muscle and tongue muscle. Extraocular muscles and tongue muscle are supplied by what nerve? Extraocular muscles are supplied by third nerve, fourth nerve, sixth nerve, right? And tongue muscles are supplied by 12th nerve. So third nerve, fourth nerve, sixth nerve, and 12th nucleus. When you look at the nucleus for third nerve, fourth nerve, sixth nerve, and 12th nerve, all these nucleus are present in one line only. And that one line is called as a column. Now, these nucleus may or may not be connected to each other. Like in some places they are connected, and some places they are not. So we have a third nucleus separate, fourth nucleus separate, sixth nucleus separate, and 12th nucleus separate. But they are arranged in the same line only. And that linear arrangement of these nuclei is called as one column. It's called as one column. So obviously, how many columns we need to supply the muscles? We need three columns, because we have three different type of muscle to be supplied. Okay. First, let's understand how exactly these columns they came into the picture. Well, guys, for that, I again need to take you to some basics here. The neural tube. When I say this is a picture of a neural tube here, if this is a picture of a neural tube can be divided in two parts by a primitive sulcus or an embryonic sulcus, and this sulcus is called as sulcus limitans. This is called as a sulcus limitans. It is limiting the neural tube in two parts, so we call it sulcus limitans. What sulcus limitans is doing, it is dividing the neural tube in two parts. As you can see, the one which I'm highlighting for you, that is a ventral part of the neural tube. That's a ventral part of the neural tube, and this ventral part is called as the basal plate. The ventral part of the neural tube is called as the basal plate, and this dorsal part of the neural tube is called as the alar plate. The basal plate and the alar plate. The two plates, more of an embryological term, so don't worry about that. We'll be discussing the neural tube again in the embryology part, but let's understand some basics here. So what you're looking at right now, you're looking at a picture of a neural tube, which is divided into two plates, the alar plate and basal plate, by the sulcus called as the sulcus limitans. A sulcus which is limiting the neural tube in two parts, right? Alar plate and basal plate. Now, alar plate is placed dorsally and basal plate is placed ventrally. Now, just for 1 second, just imagine you're not looking at a neural tube and you're looking at a section of a spinal cord. Let's imagine there's a section of a spinal cord here. If this is a section of spinal cord, then obviously alar plate will represent which horn of the spinal cord? It will represent the dorsal horn, and basal plate will represent the ventral horn of the spinal cord. And we all know that dorsal horn is sensory and ventral horn is motor. So it's just an indication that alar plate is present toward the dorsal side, it is a sensory plate, and basal plate is present toward the ventral side, it is a motor plate. So alar plate is the one which will give rise to all the sensory cranial nerve nuclei. Whatever sensory cranial nerve nuclei you can think of, they are all derived from the alar plate, and all the motor cranial nerve nuclei will be derived from the basal plate. A very simple and straight question, but this question is asked more than once in the exam, that which nuclei is developing from which plate. Like, so they will give you four options, and in the current scenario now they can give you the kind of option where you have to choose a multiple answers from. So alar plate and basal plate, all you have to do is you just have to look at the nuclei, and then you need to realize, is it a sensory nuclei or is it a motor nuclei? Like if I say let me give you some example. If I say hypoglossal nucleus, the hypoglossal nucleus is supplying tongue muscles. It's a tongue muscles, so it is a motor nuclei. That means hypoglossal nucleus will develop from where? From the basal plate. If I say, let's say nucleus of tractus solitarius. Now we know nucleus of tractus solitarius is for taste sensation. So obviously it will come from where? From the alar plate. So just have to think about a nuclei and where it is coming from. Now there are certain nerves which are mixed nerves, like trigeminal nerve. Trigeminal nerve is a mixed nerve. That means some part of the trigeminal nuclei will come from alar plate, the sensory part, and some part of the trigeminal nuclei will come from the basal part, which we will discuss. So all I'm telling you right now is that you'll be looking at the alar and the basal plate, and this alar and basal plate are going to give rise to the sensory and the motor cranial nuclei. You just have to look at the nuclei, you need to realize whether it is a sensory nuclei or motor nuclei, and then you can give this answer that okay, it is coming from where. Now coming to something really important. Now right now you're looking at a picture of a neural tube, a circular neural tube, let's say you say. Now look at me guys. Let's say if this is a neural tube here, my hand is representing the neural tube. And as I said, the neural tube will give rise to spinal cord also. So alar plate will become the dorsal horn, the ventral plate, where basal plate will become the ventral horn. And this space in between, this space that is in between here, this will become the central canal of the spinal cord, right? But let's say the same neural tube has to give rise to the brainstem also. When the neural tube will give rise to brainstem, then how it is going to look like? Now, brainstem is not be like this here. In the brainstem, there is a fourth ventricle. You know, we all know that fourth ventricle develops inside the brainstem. So when the fourth ventricle will develop inside, the neural tube has to open up. And neural tube will open up like this. Now imagine the fourth ventricle is developing inside. So neural tube will open up in this manner. So that means you can see which plate is going to what side now. Now my fingers are representing the alar plate. The alar plate has gone toward the lateral side, and basal plate will come toward the medial side. Basal plate will come toward the medial side. That means if the alar plate will go toward the lateral side and basal plate will come toward the medial side, that means your sensory nuclei will be shifted toward the lateral and motor nuclei will come toward the medial side here. So this is our next thing that you need to understand, that majority of your sensory nuclei will go toward the lateral side and most of the motor nuclei will come toward the medial side. And you can kind of apply this to this uh, to the to the questions also. If you look at the syndromes in the brainstem, those syndromes which are affecting the lateral side of the brainstem, they usually have a sensory loss. I'm not saying they don't have a motor loss, but the main if defect there is a sensory loss here, because majority of the sensory nuclei are toward the lateral side. Similarly, think of any syndrome that you can think of which is close to the midline of the brainstem, whether it is Millard-Goebbeler syndrome, medial medullary syndrome, Weber's syndrome. Then the main loss is a motor loss, contralateral hemiplegia, some facial nerve palsy or abductor nerve palsy or third nerve palsy, something like that here. So all I'm saying is that if a syndrome is close to the midline of brainstem, then it is more likely to have what loss? Motor loss. If a syndrome is more toward the lateral side of the brainstem, then it is more likely to have a sensory loss here. Now, this is you can something that you can apply. Uh, if you get, let's say you got a radiological question and you have no idea what part of brainstem you're looking at. They've shown you some medulla oblongata or midbrain or whatever, and let's say you are in a position that you're not even able to identify that what part of brainstem is this. And let's say they show some lesion over there, any syndrome or any lesion they're shown in that picture here, and they ask, okay, what will be because of this syndrome here? So at least give an educated guess that if it is toward the very close to the midline of the brainstem, then you can say, okay, it's toward the midline, toward the ventral aspect, then obviously it's motor structure which are involved in this here. So you can go with the motor option. If it is toward the lateral side of brainstem, mainly about the sensory loss. So let's take this neural tube, open it up, and see how it is going to look like. So there we go. This is the neural tube now opening up. As I said, the neural tube opened up. Why? Because of the development of fourth ventricle. So this is the fourth ventricle which is developing inside. And because of this development of fourth ventricle, as you can see, the neural tube has opened up. I'm putting these arrows to show you the opening of the neural tube. So big fourth ventricle is developing inside. Now what happened because of this uh, formation of the fourth ventricle? The sulcus limitans is now shifted anterolaterally. The sulcus limitans has gone like this toward the anterolateral side. The sulcus limitans which was on the side is now more toward the anterolateral side. So that's the sulcus limitans. And because of that, we know that which plate will come close to the midline? The plate which will come close to the midline is the basal plate here. The motor plate is close to the midline here, that is a basal plate. And the plate which is more outside, that is a alar plate. Basal plate and alar plate. Keep writing your own notes, guys. This is something which I'll keep bothering you with this line over and over again. That please write down your own notes, write down your own notes. Doesn't matter what your drawing skills are, how your handwriting is. Nobody's testing you on that. The point is, once you write it with your own hand, this is something which will, like, writing the notes means you're doing it twice already here. One, you're listening to me, and then when you're writing, then you again have to recall that what is the right thing to do. So it's a double revision going on if you're writing. If you have the handwritten notes in your hand, first of all, you're not anticipating anything. So what I'm saying is that again, you're not trying to anticipate it. Number one. Number two, you're not writing it, so you're not again recalling that thing here. So obviously, the people who will write it down with their own hand, they definitely will have more advantage over the people who just read down all these handwritten material which is available everywhere nowadays. Okay, so guys, fourth ventricle and basal plate close to the midline, alar plate toward the lateral side. So now we know that basal plate will have all the what nuclei? They will have all the motor nuclei. So motor nuclei means efferent columns, guys. Efferent. Motor is efferent. So there are three efferent columns that you see here. One, two, and three. And you know that why there are three. You know that why there are three because there are three types of muscle to be supplied, and that's why there are three efferent columns. But when it comes to afferent columns, they are actually four in number. Efferent columns are three, but afferent columns are four. That means motor columns are three, but sensory columns are four. And we will understand that why they're four in number. Let's first go in a sequence. Now, this was a very recent INICT question only in which they asked that arrange the cranial nerve columns in the sequence, in the floor of fourth ventricle. So, you need to understand the columns and you also need to understand the sequence also. You just cannot make a mnemonic on this and just try to mug it up here. Mnemonic is something I'm not a very big fan of mnemonic, to be honest, guys. I know that mnemonics are needed, but too much of mnemonic actually spoil the the thing. So I will give you mnemonics, but I'll just keep it a little less. So what are the columns that you're looking at here? The three efferent columns or three motor columns that we're talking about here. This column here, the first one, this one is called as a GSE. I'll tell you what GSE is. Then we have this column which is called as a SVE. And then we have this third column which is called as a GVE. GSE, SVE, and GVE. Now, what is this GSE, SVE, GVE? I'll tell you. When we say GSE, what GSE stands for? Well, it stands for the general, the S is for the somatic, and obviously these are efferent columns. General somatic efferent, guys. Now, the moment I say the word general somatic efferent, I need to catch this word somatic in here. Why somatic? Because which muscles are somatic? You already know that. The somatic muscles that we said are what? Extraocular muscles and tongue muscles. That means this column is dedicated to supply the extraocular muscles and tongue muscles. That's it. That's the only function of this column here, to supply the extraocular muscles and tongue muscles. So it's a general somatic efferent column. So that's all about the first column, guys. Whatever nuclei are responsible for supplying the extraocular muscles and tongue muscles, they are arranged in one line that is called as a column. What column? GSE column, general somatic efferent column. So that means the third nucleus, fourth nucleus, sixth nucleus, 12th nucleus, they're arranged in a one line only. That is GSE, general somatic efferent. Moving on, the next one. The next one we said is what? SVE. SVE. What SVE stands for? SVE is special visceral, and once again that is efferent. Special visceral efferent. Now, you know the word special visceral efferent. The word special viscera is actually a misnomer. In the Gray's Anatomy also it is mentioned here. The special viscera is basically a misnomer, and the meaning of the special viscera here is corresponding to pharyngeal arches. That's why this column is also called as a pharyngeal arch efferent or branchial efferent. Branchial efferent or pharyngeal arch efferent. So I can use the word branchial in front of it. Instead of using the word special visceral, I can use the word branchial. So either you call it special visceral efferent column, or you can simply call it a branchial efferent column. That means this column is to supply the muscles which are derived from pharyngeal arches or branchial arches. And you already know the muscles from the pharyngeal arches. Muscles of mastication, muscles of facial expression, palate, pharynx, and larynx muscle, they will all come under which column? SVE column. So basically the nuclei or the nerve which are supplying the all these muscles like facial muscle, mastication muscle, or palate, pharynx, and larynx muscle, they are arranged in this SVE column. Their nuclei are present in the SVE column. The next column that we wrote in the line is GVE. Now, general visceral efferent. This time, this means general. This is visceral, and that is efferent. General visceral efferent. Now, look, guys, what is common between the first and second column? If you look at the first and second column, what is the similarity that you see in them? The similarity between the first and second column is that both these columns are responsible for supplying what kind of muscle? They're supplying the skeletal muscles. So both these columns are supplying the skeletal muscle from somites or skeletal muscle from pharyngeal arches, but they're supplying skeletal muscle. That means the only column left here, the efferent column will supply what muscle? It will supply the smooth muscles, and not only smooth muscle, it will also supply the glands. So it's a smooth muscle and glands which are supplied by this. So that's why this column here, it is dedicated to supply the smooth muscles, and it also supplies the glands, smooth muscles and glands. So all these parotid, submandibular, sublingual gland, they're all supplied by this GVE column that we will understand. Now, let me tell you one thing right in the beginning only. So basically, we are starting with a topic which is little on the difficult side because there's too much to remember from it, and we tend to forget it. Now, my humble suggestion to you is that do not try to remember everything at once here. Just keep on understanding it here. What is general somatic efferent? The word somatic we have to catch there. Special viscerame we have to catch the word brachial. Right. So this is the just keep on understanding it here. I know that this is a kind of a topic in which you'll after 1 hour all these columns will be mixed up here. The GV will become SV, the SV will become GSC. That will happen. That happens with everyone. So as of now, just try to understand these columns here. And eventually when we'll go to the cranial nerves, you will remember more of the cranial nerve nuclei here. So this is definitely a kind of topic in which you'll go further and you'll remember the previous part better. So have patience, and I'm pretty sure that you will be able to remember and recall all these columns also. So going back to this picture, guys, GSE, SVE, GVE, the three columns, the three efferent columns done. Now coming to afferent column. When I say afferent column, now how these afferent columns are the one are they named? Like the names are corresponding. Maybe not the function, but the names are corresponding. Like it's like a mirror image. If this is GVE, guys, if this is GVE, this one here. So this column here will be the GVA column. If this is SVE, the next one here is SVA. If this is GSE, then the next one is here is GSA. And then we have one more. So let me name these first. So we said first we have this column here that is called as a GVA column. We got this SVA column, the GSA column, and then there is one more, the mystery column. Will come back to that. In fact, you will tell me what column is that, but just wait for it. So GVA, SVA, and GSA. So let's talk about these three first, and then we'll come to the fourth one, guys. Okay. So we said first the GVA and SVA. Now GVA stands for the general visceral afferent. Obviously, these are afferent columns this time. And SVA stands for special visceral afferent. Let me deal with these two first. General visceral afferent and special visceral afferent. Now, first of all, you need to understand very well that how to look at these afferent columns. Because if you look at the efferent column and then you try to fetch the meaning of the afferent column based on that, you will always get the wrong answer. So never, never, ever look at these efferent column while trying to remember the afferent columns here. So efferent columns and afferent columns are two different stories here. Nothing is corresponding to them except for the name. So forget about the efferent column for now, and let's focus on the afferent column, that how to look into it. Well, you need to look at the first two words, guys. The first word, like the first word here, it says general, and here it says special. Now that's the only possibility. The first word will be either general or special. यही दो हो सकते हैं. The first word tells you about the type of sensation. The first word always tells you about the type of sensation. What type of sensation are we talking about here? Are we talking about a general sensation, or are we talking about a special sensation? General sensation like temperature, pain, pressure, proprioception, these are all general sensation. And special sensation, like special sensation, you have like taste, you have vision, olfaction, hearing, balancing, all those are special. So you know that. So first word will tell you about what type of sensation are we talking about. The second word As you can see, the second word here is what? Visceral. The second word, again, there are two possibilities. Either it will be visceral or it will be somatic. That means the source, where the sensation is coming from. Is it coming from a viscera or is it coming from a body wall? Is it coming from a somatic structure? So the second word will always tell you that what is the source of that information, where the sensation is coming from. Is it coming from any visceral structure or is it coming from any somatic structure? Now understand one thing, whenever you say the word viscera, then viscera is usually lined by the endoderm here. Rather than looking like that inside we have viscera and outside there's no viscera here. Like stomach, intestine, all these are viscera here. And most of these viscera, they're lined by the endoderm. So endoderm is a keyword there, that anything which is derived from the yolk sac, anything which is derived from the endoderm, lined by the endoderm, that is a viscera here. Somatic or body wall could be anything, guys. Body wall, like anything else. Skin, a sensation coming from a skin, bone, muscle, proprioception coming from muscle. All those sensations are called as the somatic, are coming from the somatic structures. So sensation coming from the viscera, like if a sensation is coming from the stomach, we'll call it a visceral sensation. But if a sensation is coming from the skin or from the muscle, then we call it a sensation is coming from the body wall or from a somatic structure. Let's take one example here. Let's say you're having a cup of coffee. The temperature of the coffee or the temperature of the coffee is what type of sensation? It's a general sensation. When you're sipping that coffee, your tongue is feeling that the temperature. Is it hot? Is it cold here? That is a general sensation and coming from a viscera. Tongue is a viscera. But at the same time, you're also feeling the taste of the coffee. And the taste of the coffee is what kind of sensation? It is a special sensation. So taste is a special sensation. Same coffee, same tongue, but taste is a special sensation and the temperature is a general sensation, and both are coming from the viscera. Both are coming from viscera. Another example. Let's say if I say I have eaten too much and I'm feeling my stomach is distended. That feeling of distension of stomach. Well, when you eat too much, your stomach will get distended here. And that feeling of distension of stomach is carried by the vagus nerve. Vagus nerve will bring that information into the brainstem and will take it to what column? To the GVA column. It's a general sensation. Distension of stomach feeling is a general sensation coming from the viscera, GVA. So you need to focus on both the words here, the first as well as second. What type of sensation and where it is coming from. Type coming from. So GVA, it is nothing but the general sensation from the viscera. You know viscera, guys. Endodermal line, that is viscera. And special visceral afferent, the only special sensation, the only special sensation coming from the viscera is taste. Well, what does it mean? Am I saying that taste is the only special sensation? No, I'm not saying that. We have other special sensation also, but taste is the only special sensation which is coming from the viscera. Rest of the special sensation, they're not coming from viscera, because rest of the special sensation are coming from something which is not derived from endoderm. You get a point? And that's why those special sensation will not come into this column. I'll come to that. I'll explain that to you. But first, just make up your mind in this case. What are the special sensation we have? In total, if I talk about special sensation, taste is a special sensation, olfaction, vision, hearing, and balancing. All these are special sensation. But out of these special sensation, only taste is coming from the viscera. Tongue, like tongue is a viscera, so it is derived from line by the endoderm also. So it is a viscera. Rest of the sensation, like olfaction, hearing, and balancing, and all that, they are special sensation, but they are not derived from the viscera. Like olfaction coming from olfactory mucosa, that is not a viscera. Vision coming from the retina. Retina is derived from neuroectoderm, not a viscera. Hearing and balancing coming from internal ear. Internal ear is derived from something called as otic capsule, which is again not a viscera. So if these structures are not derived from endoderm or not lined by the endoderm, that means these sensations are not coming from the viscera. So these are special sensation for sure, but they're not coming from the viscera. Now think about it. What should be the name of the column which is carrying these sensations? The one which is carrying olfaction, vision, hearing, and balancing. Now let's analyze this again. The first word is what? What type of sensation are we talking about? Special. Olfaction, hearing, and balancing, vision, they are special sensations. So the first word is special only. Where it is coming from? Is it coming from viscera? No, it is not. It is coming from somatic structure. So we call it somatic. And obviously it's an afferent column we're talking about here. So name of the column will be what? Special somatic afferent. SSA column. Special somatic afferent column. And that's why we left one column there. That's why we have one additional column in there, which is called as a SSA column, special somatic afferent column. That's the reason we have three efferent columns, but we have four afferent columns now, right? So we have SSA, that is special somatic afferent, which I will write for you. Just telling you that of why the fourth column is there, because the special sensation are coming from two different sources. Taste is coming from the viscera, but rest of the special sensation, they're not coming from viscera. So that's why you have to have a different column for that, and that is called as a special somatic afferent. Now don't worry about this. I'll revise all these columns for you again. Once I'm done with this, I'll revise all the columns for you. So just wait for it, understand these columns. Now let me go in a sequence again. The next column here is actually GSA, and then we have SSA, right? That's how it was. Now GSA, what GSA stands for? It is general somatic afferent, general somatic afferent, general sensation from the somatic structure. The moment you think of general somatic afferent, I would say the best nerve that can come to your mind with respect to head and neck. What is the nerve which is carrying the general sensation from the head and neck region mainly? And that's the trigeminal nerve. The best and the best example is a trigeminal nerve. Our trigeminal nerve is responsible for carrying the general sensation from the face. Like ophthalmic nerve will carry everything from the forehead region, whether it is pain or temperature or proprioception or whatever it is. Everything is carried by the ophthalmic nerve here, maxillary nerve, the mandibular nerve. So basically, general sensation, not the special sensation. The first word is general, sensation is general, and coming from where? Body wall structure, something which is not lined by endoderm. So it is about the general sensation from body wall, or you can say something somatic. General sensation from a body wall structure or somatic. And then we have this SSA column, that is a SSA column. The SSA column, what SSA column stands for, guys? SSA column is a special somatic afferent. This column is special somatic afferent. Now see, what's the interesting part here? You already know that there are three sensations which comes into the special somatic afferent here. What is there in the special somatic afferent? We said olfaction. Yes, olfaction will be there. Then vision, and then hearing and balancing, right? So all these are special sensation, definitely. And you know that why they are in the SSA column, because they are coming from something which is not a viscera. So olfaction, vision, hearing, and balance. Now, see, interesting part is olfaction comes from which nerve? Olfactory nerve. First nerve, olfactory nerve. Vision comes from the optic nerve, that is the second cranial nerve. And hearing and balancing come from the eighth nerve, that is vestibulocochlear nerve. Now, listen to this carefully, guys. The catch is, if the question is asked that which nerves come under SSA column, nerves, not the nuclei, nerves, then you have three answers. We have the first nerve, we got the second nerve, and we got the eighth nerve. So there are three answers you have: first nerve, second nerve, and third nerve. They are type of SSA nerve. They are carrying the special sensation from the somatic structure. But if the question is asked which nuclei come under SSA column, nuclei, then obviously you all know that olfactory nerve and optic nerve, they do not have any nuclei. So they don't have a nuclei. There is no brainstem nuclei for the olfactory nerve. There is no brainstem nuclei for optic nerve. Optic nerve directly goes to the visual cortex. Olfactory nerve goes directly into the rhinocortex. So they don't have any nuclei here. But eighth nerve is having a nuclei. Eighth nerve is having a nuclei that is called as a vestibular nuclei. That is called as a vestibular nuclei and cochlear nuclei. There are multiple nuclei actually. Vestibular nuclei and cochlear nuclei. So now be careful with this question, that how this question is asked. If the question is asked that what nerves come under SSA column, then you have to go with the first nerve, second nerve, and eighth nerve. But if the question is asked what nuclei come under SSA column, then you will only say it is vestibular nuclei and cochlear nuclei. Vestibular nuclei and cochlear nuclei. So be very careful, because this is, this is what happened when you're sitting in the examination hall in front of that computer screen. You know that you're not able to, if your brain is not relaxed, then you're not able to read these things here. It's easy to say as at this point of time that if nucleus is given, write this, nerve is given, write this here. but that time you're so anxious that you don't read that question properly even. So in this thing, just be careful with that. Nuclei, only nerve having nuclei out of these three is the eighth one. First and second nerve, there is no nuclei with that. But if the question says that, okay, mark the nerves, like around nowadays we have this multiple choice answer kind of question. A is correct, A, B, C is correct here. So which nerves come under SSA column? So you got to go with the first one also, the second one also, and the eighth one also. Right? Okay. Now, guys, this is about the cranial nuclei and column. Now, let's do one thing. Let's have a quick recap on this entire thing. And I want you people, see, this is how we're gonna go about the entire anatomy, and this is what I want from you people. Whenever we revise anything here, don't try to look into your notes, look at the screen most of the time, and then try to anticipate what is about it here. Because if you just keep reading what is written over there, that's kind of reading a manuscript only here. So let's not do that here. Okay. Let's go with the first one, guys. What is the first column there? As you can see, the first column there is a GSE. Now, GSE means General Somatic Efferent. And you know, whenever we say the word somatic, somatic क्या याद दिलाता है, guys? Somatic means it is supplying the extraocular muscles and tongue muscle. That means this column is dedicated for extraocular muscles and tongue muscles. Second column, SVE, Special Visceral Efferent. The word special viscera here is a misnomer. The special visceral efferent is basically the pharyngeal arches. Special visceral efferent is a pharyngeal arches. So it's a branchial efferent. All the muscles supplied by the pharyngeal arches will come into this column, like the muscles of mastication, muscle of facial expression, muscle of palate, pharynx, and larynx. They will all come into this column. Then we have a GVE column, General Visceral Efferent column, guys. General Visceral Efferent. If you look at the first two columns, the common thing between them is what? They're supplying the skeletal muscle. So GVE column, the only column left now, is supplying what muscle? It is supplying the smooth muscles and glands. That's a column for smooth muscle and glands. So extraocular and tongue muscle, muscles from pharyngeal arches, and now we have smooth muscles and glands in this column. Nomenclature of the afferent column, just like a mirror image. Like if I say SVA, the SVA obviously here is what? SVA is GVA, I'm sorry to start with. General visceral afferent, the general sensation coming from viscera. Could be anything. Could be, I told you the example, like temperature of the coffee, distension of the stomach. You feel that the burning sensation, acidic sensation, sometime whatever. If a sensation is coming from viscera, whatever it is all going to which column? The GVA column. General sensation coming from the viscera. Special visceral afferent. The only special sensation coming from viscera is what? Taste. Taste is the only special sensation coming from the viscera. GSA, very important column when it comes to exam, that there are loads of questions asked on this GSA column. General somatic afferent, general sensation. The first word is general sensation. Coming from where? Somatic structure, that means body wall, afferent, right? So general somatic afferent, that means it is carrying the general sensation from body wall. And the one of the best example you can think of is a trigeminal nerve. The trigeminal nerve carrying the different kind of sensation from face, and they will all go into the GSA column, general somatic afferent. And then we have this SSA column, the special somatic afferent column. Now, this special somatic afferent column is the one which is responsible for it is responsible for carrying the special sensation, but those structures are not viscera. They're not derived from endoderm. They're derived from ectoderm, right? So that includes the olfaction, that includes the vision, and also includes the hearing and balancing. But out of all these, it's the hearing and balancing. That means the vestibular nuclei and the cochlear nuclei. Nuclei are there for the eighth nerve, but there is no nuclei for first and the second nerve, right? So that's about the columns here. Okay. No, Darshan. See, the point is, it's not about the column. It's about what kind of nerves are those. It's they're not having a nuclei here. But if I ask you that olfactory nerve, had it been the olfactory nerve having a nuclei, if there was a nuclei for the olfactory nerve, and wherever the olfactory nerve is relaying into the cortex, rhinocortex, that area of the rhinocortex is what type? Then you will say it is a special somatic afferent kind of area here. So that's my question point here. The type of nerve and the type of nuclei. Column, I understand. See, don't stick too much to the word column here, because sometimes you use the word column, you won't believe even for the white matter also. Like we call dorsal column tract. So column doesn't always mean that nuclei arrangement in one line is called as column. I said the general definition is that when the nuclei are arranged in one line, we call them a column here. But if the question is asked for the nerve, the first and second nerve are also kind of nerve which are having the function which correlates to the special somatic afferent type. It's one of the AIMS question also. Yes. Yes, so that's what is it. GSA is carrying the sensation, the structure which is not lined by the endoderm. The structures like muscles, think about sensation coming from the skin, proprioception coming from muscle. All this will come into GSA column. You'll understand this better. We still have to discuss more about these columns here. You'll understand it. My only purpose till now was to just to tell you that what are the columns we have in total and what these columns they basically correlate to here. Now we'll discuss further, and then I'm pretty sure that will understand these columns even better. Okay, so I hope you understood a little about these columns, that how exactly the nomenclature is given to them. So now let's take all these columns here and put them in the brainstem, and then we will see what nerves will come under them, what nuclei will come under them here. So here we go. So I'm going to draw these columns for you, and I would request you to do the same here, guys. Let's say this is the first column here, the second column, the third column, the fourth column, in which you have to keep the two columns together. Actually, I'll tell you the reason for that, and the last two. So let's go in a sequence here. The sequence is important. This is what they ask the question on as well. And the GSE, that's the first one. Then we have SVE, and then we got the GVE. Right? These are three columns here. So let's stick to these three here, and then we'll take care of the rest of it. Just let's talk about these. Okay. Midbrain, pons, and obviously medulla oblongata. That's how the nuclei will be distributed here. The midbrain, pons, and medulla oblongata. The midbrain, pons, and medulla oblongata. Now, again, you have to exercise this thing, that what comes under what, and then you can arrange the nuclei accordingly. Now, we say GSE, general somatic efferent. You already know somatic reminds you what muscle? Extraocular and tongue muscle. So, whatever nuclei which are supplying the extraocular muscles, they will come into here. That is third nerve, fourth nerve, sixth nerve, and 12th nerve. 3, 4, 6, and 12, they are the ones supplying the extraocular and tongue muscle. Now, out of which third and fourth nucleus are present in the midbrain. Third nucleus and the fourth nucleus are present in the midbrain. Sixth nucleus is present in the pons, and the big 12th nucleus, hypoglossal nucleus, is a big nucleus, and that is present in the medulla oblongata. 3, 4, 6, and 12. But it's important that where is 3, where is 4? Third and fourth are in the midbrain. Where is specifically in the midbrain, that we will talk about here. So third and fourth in the midbrain here. Sixth is in the pons, and the 12th is in the medulla oblongata. 3, 4, 6, and 12. Okay. Then we have SVE column. Now you already know the SVE reminds you of what? Pharyngeal arches, guys. The SVE, that is about pharyngeal arches. So this column is basically for the nuclei or the nerve supplying the pharyngeal arches. Now look at this. What is the nerve supplying the first pharyngeal arch? The first pharyngeal arch is by the mandibular nerve. So you will see this motor nucleus of mandibular nerve present in the pons. It's the motor nucleus of mandibular nerve. Second arch is supplied by what now? Facial nerve. So just below that we have a facial nucleus. The motor facial nucleus is there. Now for first arch, now for second arch. We're going in the sequence only. Then again we have a big collective nucleus present in the medulla oblongata. Now that's a collective nucleus for the ninth nerve, which is a nerve for the third arch. 10th nerve, which is a nerve for the fourth arch and sixth arch. And even 11th is also there. I'll tell you why 11th is there. This nucleus, guys, is called as nucleus ambiguous. This nucleus is called as nucleus ambiguous. Now see, what makes sense and what doesn't make sense here. Mandibular nerve is a nerve for first arch, it should be there in that sequence only. The nerve for second arch is facial nerve, should be there. Nerve for third arch, glossopharyngeal nerve, should be there. Nerve for fourth and sixth arch, vagus nerve, should be there. But where this 11th came from? Now the question is, what 11th is this? It is actually is it cranial accessory or is it spinal accessory? First of all, guys, it is a cranial accessory nerve. And why I'm putting a cranial accessory in this column, which is purely for the pharyngeal arches. We never said that cranial accessory nerve supplies any muscle of pharyngeal arch. Then why are we putting in this column here? Actually, cranial accessory nerve does supply the muscles derived from pharyngeal arches, but it is not supplying them directly. It is supplying them with the help of vagus nerve. Now, understand this concept here. We all know jugular foramen. There's a recent question also on the jugular foramen. Jugular foramen gives passage to vagus nerve, and the jugular foramen gives passage to the cranial accessory nerve also. What happens is the cranial accessory nerve comes out of the jugular foramen and joins with vagus only. So whatever cranial accessory nerve is going to supply, it is going to supply via vagus. So it does look like there are certain muscles which are supplied by the vagus nerve, but they're not supplied by vagus nerve. They're supplied by actually cranial accessory nerve. And what muscles are those? Those are muscles of palate and muscles of pharynx. So let me write that for you separately first. That muscles of palate and pharynx. Muscles of palate and pharynx. Not larynx, guys. Only muscles of palate and pharynx. They are supplied by which nerve? We said cranial accessory nerve. But how? Via vagus. Cranial accessory via vagus. And that's why this arrangement is also called as vago accessory complex. It is called as a vago accessory complex here. Vago accessory complex. From now onwards, we'll call it VAC. Just in the short, we'll call it VAC from now onwards. Vago accessory complex. So muscles of palate and pharynx. You think of any muscle of palate like palatoglossus, or think of like any other muscle of pharynx here, any constrictor, superior constrictor, or any other muscle. So they are all supplied by the cranial accessory nerve. Cranial accessory, actually, I should write 11th here. Cranial accessory via vagus. Cranial accessory via vagus. That is called the vago accessory complex. We'll understand this vago accessory complex a little later, so we'll come to that. But it is also to be noted that nucleus ambiguous is a common nucleus for three nerves: ninth nerve also, 10th nerve also, 11th nerve also. So imagine if the nucleus ambiguous is injured, if there is any vascular lesion or any injury to the nucleus ambiguous, then what will happen? All the muscles supplied by the nucleus ambiguous will be gone. That means palate muscles, pharynx muscle, larynx muscle, all these muscles will get affected here. And that will lead to the ipsilateral bulbar paralysis. So if there is an injury to nucleus ambiguous, so nucleus ambiguous, guys, injury to the nucleus ambiguous will lead to what? Ipsilateral bulbar paralysis. Ipsilateral bulbar paralysis. Bulbar paralysis. Muscles of palate, pharynx, and larynx of one side will be gone. So that is called the ipsilateral bulbar paralysis. And not only that, it will also lead to loss of gag reflex. As we know, ninth and 10th nerve are responsible for gag also. So there is a loss of gag reflex also. So remember this important point here, that nucleus ambiguous, injury to nucleus ambiguous will cause ipsilateral bulbar paralysis, and it can also lead to the loss of gag reflex. So that's the importance of this nucleus ambiguous. So guys, the first two columns, we're done with the first two columns. The first two columns which are supplying the skeletal muscles. The first column, skeletal muscle from the somites. The second column, skeletal muscle from the pharyngeal arches. Done with that. Coming to third column, guys, the GVE column. And this is a column from where loads of questions are being asked here. And you need to understand this column very well, because as I said, the questions are being asked from there. And moreover, you will also see that there are different questions which can be formulated out of it here. GVE. Now, think about what GVE column is for. The GVE column is to supply the smooth muscles and glands. That's what the column is for, to supply the smooth muscles and glands. Smooth muscles and glands are supplied by the GVE. So, what nuclei will come under them? Now, the nuclei which you will see inside them will be, is a nucleus present in the midbrain, and that nucleus is called as a Edinger Westphal nucleus, EW. Edinger Westphal, you all know what Edinger Westphal is there. Then we have the two nuclei which are present in the pons, and these two nuclei present in the pons are called as a salivatory nucleus. So we have a superior salivatory nucleus, and there is an inferior salivatory nucleus. Superior salivatory and inferior salivatory nucleus. And then there is a nucleus which is present in the medulla oblongata. Again, a big nucleus present in medulla oblongata. And this nucleus is called as a dorsal nucleus of vagus. It's a dorsal nucleus of vagus. Sorry. The dorsal nucleus of vagus. So Edinger-Westphal nucleus, superior salivatory, inferior salivatory, and dorsal nucleus of vagus. So let's take these four nucleus separately, and you will see that there are so many questions which can be formulated out of them here. So I'm going to take this GVE column and let's discuss more in detail here. So here again I'm writing GVE. The nuclei there is EW, Edinger-Westphal, followed by the two salivatory nucleus, superior salivatory and inferior salivatory. Make sure you remember their location also, guys. Superior salivatory and inferior salivatory nucleus, they're present in the pons. And then we have the dorsal nucleus of vagus, which is present in the medulla oblongata. Dorsal nucleus of vagus, which is present in the medulla oblongata. So to understand what exactly these columns are responsible for, okay, so 1 second. So Edinger-Westphal, the fibers. Edinger-Westphal is responsible for supplying. We said this column is to supply the smooth muscles and gland. Well, which smooth muscle and gland are we talking about here? The smooth muscle and gland we're talking about here are the smooth muscle and gland we're talking about here are we have sphincter pupillae and ciliaris muscle. No gland in there. It's a sphincter pupillae and ciliaris muscle, smooth muscle. Edinger-Westphal responsibility is to supply the sphincter pupillae and ciliaris muscle. But how? You need something to supply them. That's a nuclei. That's a target structure. We need a nerve. Which nerve supplies the sphincter pupillae and ciliaris? That is a third nerve. Oculomotor nerve is a nerve for Edinger-Westphal. Oculomotor nerve is a nerve for Edinger-Westphal. Superior salivatory nucleus, and then we have inferior salivatory nucleus. Now, when it comes to salivation, if I just talk about salivation, guys, then their name and their function is kind of opposite. The one which is called the superior salivatory nucleus is going to supply the gland which are below. That is submandibular and sublingual gland will be supplied by superior salivatory nucleus. Inferior salivatory nucleus, the nucleus is below, but that is supplying the gland which is present above. Like parotid gland will be supplied by that here. So if we talk just about the salivary gland first, let me go with the salivary gland first. Superior salivatory nucleus supplies the submandibular, sublingual gland, where inferior salivatory nucleus supplies the parotid gland. Just for the salivation here. But let me tell you something. Inferior salivatory nucleus supplies only the parotid gland. Superior salivatory nucleus is not only supplying the submandibular sublingual gland. You think of any other gland in the head and neck, they are all supplied by superior salivatory nucleus only. Like submandibular, sublingual gland, nasal gland, lacrimal gland. They're all supplied by even nasal gland, even lacrimal gland. They're all supplied by the superior salivatory nucleus. So don't fall for the name of the nuclei. Name says superior salivatory nucleus. That doesn't mean it is only for salivation, guys. It is supplying the submandibular sublingual gland, but it is also supplying the nasal gland. It is supplying the lacrimal gland also. And this question on the lacrimal gland is again asked more than once, that secretomotor fibers of lacrimal gland will come from where? And people are hesitant to mark this answer because it says lacrimal gland. So how can we mark the answer superior salivatory? But this is the answer actually. Superior salivatory nucleus is the one which is responsible for supplying the submandibular gland, sublingual gland, nasal gland, and even lacrimal gland is by superior salivatory nucleus. So basically, lacrimatory nucleus is a part of superior salivatory nucleus only. The question is, what nerves are responsible for that? The nerve for the superior salivatory nucleus is the facial nerve. So facial nerve is the nerve for the superior salivatory nucleus. That means all the submandibular, sublingual gland are supplied by facial nerve. And the nerve for the inferior salivary nucleus is the glossopharyngeal nerve. Parotid gland is supplied by the glossopharyngeal nerve. So these are nerves. Obviously, from the superior salivary nucleus, the facial nerve fibers will come out, and it's the facial nerve which is carrying the secretomotor fibers for the submandibular, sublingual, nasal, lacrimal gland. Then we have the dorsal nucleus of vagus. The dorsal nucleus of vagus, obviously the name says vagus, so it's a vagus nerve which is there in it. The vagus nerve will be part of it. What it is going to supply? The dorsal. See, vagus is the only cranial nerve which is going beyond head and neck. If you think of head and neck, the nerve going beyond head and neck is like vagus nerve. So that means the vagus nerve is the one which is going to supply the smooth muscles and glands. Where? In thorax and also in abdomen. In thorax as well as abdomen. So smooth muscles and gland in thorax and abdomen, they are supplied by. So think of any smooth muscle like esophageal smooth muscle or any gastric gland you can think of. They're supplied by vagus nerve only. So it's a long vagus nerve which will leave the head and neck region and then will go and supply the smooth muscle in the thoracic region also and the abdominal region also. Now, what important thing that we need to notice from here is, guys, that see, uh, the thing is, if you look at the nuclei there, Edinger, Westphal, superior salivary, and you look at the nerve connected to them, third nerve, seventh nerve, ninth nerve, 10th nerve, there must be something special about these nerves here. These four cranial nerves, they are definitely special nerves because they are supplying smooth muscles and glands, and these four cranial nerves are called as parasympathetic cranial nerve. Parasympathetic, guys. Third nerve, seventh nerve, ninth and 10th nerve, they are parasympathetic cranial nerve because they are supplying smooth muscles and gland. So that's a question here, that which cranial nerves are called as a parasympathetic cranial nerve, and the answer is 3, 7, 9 and 10. So that's our answer here. Let me just mark these for you. 3, 7, 9, 10. These four cranial nerves are also called as parasympathetic cranial nerves. Parasympathetic cranial nerves. 3, 7, 9 and 10, they are parasympathetic cranial nerves. Now, how this question is asked, again, as I said, what you need to understand that how the same question can be asked in a different time, in different format here. When this question was asked for the first time, they asked that which nerves come under the parasympathetic column. 3, 7, 9, 10. They even asked this question that which column is called as a parasympathetic column, guys. What column are we talking about? The GVE column. So GVE column is a parasympathetic column. That is obviously the column we're discussing here is a GVE column, so that is a parasympathetic column. Ames even asked this question that which nerves forms the parasympathetic outflow. Now we need to add something to that here. When you say autonomic outflow, guys, parasympathetic outflow and sympathetic outflow. See, what's the difference? There are two types of outflow. Now, when I say parasympathetic outflow, guys, it is also known as craniosacral outflow. Why do we call them craniosacral outflow? Because there are some cranial nerves which are parasympathetic, and there are some sacral nerves which are also parasympathetic. See, 3, 7, 9th nerve, they are mainly parasympathetic to head and neck area. 10th nerve, vagus nerve is parasympathetic to thorax and abdomen also. But vagus nerve cannot supply everything, guys. When you go into the pelvic region, the pelvic and perineal region, the parasympathetic supply from in that region come from some sacral nerves. S2, S3, and S4 nerves are also parasympathetic. That's why we call it a craniosacral outflow. So cranio corresponds to the cranial nerve. Well, which cranial nerve? It is 3, 7, 9, and 10. And then we said sacral. Now, which sacral nerves are parasympathetic? That is S2, S3, and S4. 3, 7, 9, 10, S2, S3, S4. That's the complete answer. This is a question asked twice actually, that which nerves forms the parasympathetic outflow. So it's a 3, 7, 9, 10, S2, S3, and S4. S2, S3, and S4. Now they've already asked this question. Obviously, they will not shy away from asking the question like, what is a sympathetic outflow, guys? Now, what is a sympathetic outflow? The another name for sympathetic outflow would be sympathetic outflow. It is also known as the thoracolumbar outflow. That is referred as the thoracolumbar lumbar outflow, thoracolumbar. Now, what does it mean? It means that there are some thoracic nerves and some lumbar nerves which are sympathetic in nature. Now, thoracolumbar, thoracic nerve and lumbar nerves. Which thoracic nerve? Well, all thoracic nerve. T1, T2, T3, T4, T5, T6, T7, T8, T9, T10, T11, T12, all of them, and the first two lumbar nerves, L1 and L2. That means starting from T1 all the way till L2, T1 to L2 nerves, these are having a sympathetic function also. These are the nerves which basically contribute to sympathetic chain, and that's why these are the sympathetic outflow, T1 to L2. Even the face is supplied by the T1 nerve. Now, first sympathetic nerve is T1 nerve only. So T1 sympathetic nerve goes into sympathetic chain. Thankfully, we have a chain, so chain will allow the T1 fiber to ascend upward, and then from the superior cervical ganglion, the fibers will come out to supply the face. That's why the injury to T1 can also lead to Horner syndrome. We read about the Horner syndrome in clump-case palsy also. In clump-case palsy, the injury is to C8 and T1 nerve. T1 nerve is the first sympathetic nerve, and that nerve supplies the sympathetic supply to the face also. That's why injury to T1 can lead to the Horner's syndrome. Can lead to Horner syndrome, which again we will discuss further. But as of now, understand this. They have asked this question earlier also, that parasympathetic outflow is by which nerve? 3, 7, 9, 10, S2, S3, S4. If the question is asked on sympathetic outflow, you got to go with the T1 to L2 nerve. T1 to L2. So guys, this is about this column here, the GVE column. We understood quite a few things based on this GVE column here. Edinger-Westphal, sub third nerve related to the superior salivary nucleus. Which nerves are related to what nuclei? That is also very, very important. So it's a parasympathetic column. The GVE column is a parasympathetic column. Well, let's fall back to our topic. Now, once again, coming back to these columns here, the first column, extraocular and tongue muscle. The second column, muscles of pharyngeal arches. The third column, smooth muscles and gland. That's what we just saw, that Edinger-Westphal and salivary nucleus and all, they are supplying the smooth muscles and gland. So that's about the efferent columns done. Now, coming to afferent columns. First of all, when you talk about the afferent columns, guys, we know the sequence here. We have to go like a mirror image. We have a GVA, then we have a SVA. But one important thing that I wanted to remember is that just write GVA and SVA together. I'll tell you why. Just write the GVA and SVA together. Then obviously the next one will be what? GSA. And the last one, guys, what was the last column? That was a SSA column. That is a SSA column. GVA, SVA together. Then we have a GSA and then we have a SSA column. Okay. Why we are writing GVA and SVA together? The reason for putting them together is because there is one nuclei which is doing both the function. There is one nuclei which is a GVA also, which is a SVA also. That means there is a nuclei which is carrying the temperature of the coffee as well as a taste of the coffee. It is carrying the general sensation from viscera as well as a taste sensation from the viscera, and that nucleus is present in the medulla oblongata. Now guys, this big nucleus present in the medulla oblongata, and the speciality of this nucleus is that there is nothing above this nucleus, there is nothing below this nucleus. You can imagine how special this nucleus is. There is nothing above it and there is nothing below it. It is the only nuclei collectively in two columns, not even one. It is the only nuclei collectively present in two columns here. And that's why it is called as the nucleus of Tractus solitarius. Solitarius word comes from where? It came from the word solitary. Solitary means alone. It is alone. Nothing above, nothing below. So that's why this is called as a nucleus of Tractus solitarius. It is called as the nucleus of Tractus solitarius here. The solitary tract nucleus, the nucleus of Tractus solitarius. Nucleus of Tractus solitarius. Okay. So the point is that if this nucleus is responsible for carrying the taste sensation as well as the general sensation. See, the cranial part of this nucleus, guys, the upper part, the cranial part of this nucleus, the upper part, it is basically carrying the taste sensation. So that's the SVA part. The larger caudal part of this nucleus is carrying the general sensation of viscera, that is the GPA part. So SVA in the cranial and GVA in the caudal part. But viscera, both sensation coming from viscera. Taste also and any other general sensation from viscera will also come into this column here, into this nuclei, the nucleus of Tractus solitarius. So see that what makes it so special here. Imagine if there is an injury to this nucleus, that means any muscle, not muscle, sorry, any sensation which is coming from viscera is gone. Whether it is a general sensation of viscera or is it a special sensation which is a taste sensation coming from viscera will be gone. The visceral sensation will be gone if the nucleus of tractus solitarius is injured. So in other words, I can say nucleus of tractus solitarius is a visceral nuclei. It is carrying the sensation from the viscera, not from the body wall, not from the somatic structure, from the viscera. Well, that's about the GV and SVA column collectively. Then comes the the BAP of all the column, I would say that is GSA column, guys. General somatic afferent. Now I told you that whenever we say general somatic afferent, you need to think about which nerve? Trigeminal nerve. General somatic afferent, basically it is carrying the general sensation from the somatic structure. And the best example in head and neck here is a trigeminal nerve. Trigeminal nerve carries all the general sensation from the facial region. And that's why the nucleus present in this column is also called as a trigeminal nuclei. Now understand one thing, guys. Though I am saying that trigeminal nuclei is the only nuclei present in this column, it doesn't mean that only trigeminal nerve can come into it. Any nerve which is carrying the general sensation from the body wall can come into GSA column regardless of what is the name of the nuclei. Although the nuclei present in this column is called as a trigeminal nuclei, but if there is another nerve which is carrying a general sensation from the body wall, that can also come into it. We'll discuss that. First of all, the nuclei, guys. This big nuclei here over there, which is having a part present in midbrain, some part in the pons, and then we have a long part present in medulla oblongata and going beyond medulla also. This big nuclei there is called as a trigeminal nuclei. That's a trigeminal nuclei. Now, what are the parts of trigeminal nuclei, how to distribute them, and we'll discuss that here. Just write the name of the nuclei for now. That's a trigeminal nuclei. Right? That's a trigeminal nuclei. So some part is in the midbrain, some part is in the pons, major part is in the medulla oblongata, and it is going even beyond medulla oblongata, guys. It is going beyond medulla oblongata also. This nuclei is actually reaching the spinal cord also. Okay. Now, before we discuss the details of this GSA column, let's focus on this SSA first. Let's talk about the SSA column, the special somatic afferent, and then we'll come back. SSA column, if you remember, it is special sensation from viscera. And we already have said that first nerve, second nerve, they don't have a nuclei. There is no nuclei for first and second nerve. The only nuclei we have is for which nerve? Eighth nerve. So the nuclei in this column, the nuclei in this column will be which one? Eighth nuclei. That is vestibular nuclei and the cochlear nuclei. So we got the vestibular nuclei. This is V for vestibular and C for cochlear. Vestibular and cochlear nuclei. Just make sure draw them at the pontomedullary junction. Most of the vestibular and cochlear nuclei, they're present at the pontomedullary junction. This one, pontomedullary junction. So it's not one nuclei, we have multiple nuclei actually. We have multiple vestibular nuclei, we have a dorsal and ventral cochlear nuclei, but more or less, not exactly. We'll discuss the detail when we'll come to that part. Then more or less they're present close to the pontomedullary junction, at the pontomedullary junction. Right? So as I already told you that if the question is about the SSA column, the nuclei in the SSA column, the answer is only vestibular and cochlear. Guys, then we have the GSA. Come back to the GSA column here. Let's complete this GSA column and understand this here. The big nuclei present in there. So we have this trigeminal nuclei present in this GSA column. Trigeminal nuclei present in this GSA column. And there are different parts of the trigeminal nuclei that we need to discuss here. Now, the cranial most part, it is present in the midbrain. And guys, the midbrain is called as what? Midbrain is called as mesencephalon. That's why the nucleus is also called as a mesencephalic nucleus. This nucleus is present in the midbrain, and that's why we also call it the mesencephalic nucleus. Mesencephalic. Then we have this nuclei which is present in the pons, and this nucleus is called as a principal sensory nucleus, or you can also call it the chief sensory nucleus. Principal sensory or chief sensory nucleus. principal sensory or chief sensory nucleus. And then we have the nucleus which is present in the medulla oblongata. In fact, it is going beyond medulla oblongata, even reaching the spinal cord. It actually reaches till the C2 level of the spinal cord, guys. This is one of the question asked here, that till what level we have this nucleus extending. Trigeminal nucleus extending till the C2 level, second cervical segment level. And this part of the trigeminal nuclei is called as what? It is called as a spinal nucleus. It is reaching the spinal cord, so let's call it the spinal nucleus. It is called the spinal nucleus. It's called the spinal nucleus. So three part of the trigeminal nuclei: mesencephalic, principal sensory or chief sensory nucleus, and the spinal nucleus. Well, why the three different names are given to them? Because of three different type of sensation they are receiving. Mesencephalic nucleus, it is responsible for receiving the proprioception. Proprioception. So all the proprioceptive information will come into the mesencephalic nucleus. Proprioception, guys. Any muscle you can think of, the proprioception will come into the mesencephalic nucleus. Another important thing about the mesencephalic nucleus is that it is the center for jaw reflex, or you can say mesenteric reflex, the center for jaw reflex. When you tap your jaw, then obviously you send the proprioception inside. And for that proprioception, you get the reflex. So it is a site for the jaw reflex or mesenteric reflex, which is a question asked here. And another question which is asked on this, that mesencephalic nucleus, it is the only site in the central nervous system which is having pseudo-unipolar neurons. We don't have pseudo-unipolar neurons inside CNS, guys. We have pseudo-unipolar neurons present outside CNS, usually. Dorsal root ganglia, geniculate ganglion, trigeminal ganglion, they are all pseudo-unipolar. But in the central nervous system, inside the central nervous system, that is the only site. So that's another question to be remembered from there. It is the only site for pseudo-unipolar neurons. Well, guys, the pseudo-unipolar neurons in where? In CNS. I'm only talking about central nervous system. In peripheral nervous system, there are loads and loads of example of what do you say, the pseudo-unipolar. But in the central nervous system, the only site for pseudo-unipolar neuron in is mesencephalic nucleus. Principal sensory nucleus, it is responsible for receiving the touch and pressure. Touch and pressure will go into the mesencephalic, this principal sensory nucleus. Whereas spinal nucleus, which is clinically very important, it receives the pain and temperature. It receives pain and temperature. So mesencephalic nucleus has to receive proprioception, principal sensory nucleus will receive the touch and pressure, and pain and temperature will go to the spinal nucleus. So all the part of trigeminal nuclei only, but the three different part of trigeminal nuclei having three different function also. Mesencephalic nucleus for proprioception, chief sensory for touch and pressure, and spinal nucleus for pain and temperature. Also do understand one thing, that when the sensation comes inside, they'll relay into these nuclei, most of them, and from there they will go into the thalamus then, which we will discuss that part later on. I'm just giving you one overall view here, guys. The trigeminal nerve, let's say, will carry the sensation here. The proprioception will go inside here. The touch and pressure will go here. The pain and temperature will go here. Now, what is the journey from here onwards? The from this nucleus, the sensation will be sent to what? Thalamus. And from thalamus, the sensation are sent to the cortex, cerebral cortex. So that's the entire pathway. But we will discuss this entire pathway in the neuroanatomy. You just need to know that what is the function of these nuclei here. And especially keep an eye on the mesencephalic nucleus. There are multiple questions asked on this here. It is a nucleus for proprioception. It is a nucleus for jaw reflex. It is a site for what neuron? Pseudo-unipolar neurons. All these questions have been asked on the mesencephalic nucleus. Spinal nucleus, there's something special about spinal nucleus also. Spinal nucleus is carrying what? Pain and temperature. Fine. It is carrying pain and temperature. But the cranial most part of the spinal nucleus is also having a similar function like principal sensory nucleus. Cranial part of the spinal nucleus is having a similar function like principal sensory nucleus. That means this portion, the one which I'm pointing out right now for you, this one, the upper part of the spinal nucleus, it also receives a touch and pressure. So some amount of touch and pressure will go into which one also? Spinal nucleus also. So it is not wrong to say that spinal nucleus receives pain and temperature. Yes, definitely. But it does receive touch and pressure also in the cranial most part. Touch and pressure also goes into it in the cranial most part here. Proprioception is not going into it here. I remember the question asked was like in this way only, that which of the following sensation is not going to relay into the mesencephalic nucleus. So which sensation will not go into the mesencephalic nucleus? Like these are not going to mesencephalic nucleus. Touch is not going, pressure is not going, pain and temperature is not going. It is only for what? Proprioception here. This question is asked in the AIMS exam also, like spinal nucleus. Spinal nucleus is responsible for receiving which sensation? So pain and temperature, definitely that's the most important, and some amount of touch and pressure also. The answer is what is not carried into it is a proprioception. Which of the following sensation is not going into the spinal nucleus is proprioception. So guys, this is about the trigeminal nuclei, which again we'll understand better the trigeminal nuclei when we'll discuss the more about the trigeminal now. So this is the overall discussion on the cranial nerve nuclei and columns. We still need to find out that which nerve is connected to which column. We'll discuss that here. But as of now, you know that, okay, these are the columns and these are the nerves that we have. Okay. Just again, a very quick recap on this. Once again, what I want from you is just to keep your pen down. Don't look into your notes. Look at the screen here and just try to recap this entire thing here. Okay. The first column, the GSE column, the general somatic efferent, guys. General somatic efferent. That means the column is for somatic, that is extraocular and tongue muscle. So third nerve, fourth nerve, sixth nerve, and 12th nerve nuclei will be there. Third and fourth nucleus, important thing, they are present where? In the midbrain. The location is very important. Sixth nucleus is present where? In the pons. And hypoglossal nucleus supplying tongue muscle is present in medulla oblongata. And you know why you need to know these nuclear level also? Like when we'll read the brainstem syndrome, if I say there is a so and so syndrome, there is a Wallenberg syndrome, or there is a medial medullary syndrome, then you need to know that in that syndrome is affecting which part of brainstem. Let's say if I say the syndrome is affecting the medulla oblongata, medial medullary syndrome affecting the medulla oblongata. So in medulla, look at the nuclei present in the medulla oblongata. What are the nuclei in the medulla oblongata? Then you need to know that which nuclei are close to the midline. Like hypoglossal nucleus is very, very close to the midline here. And that's why it is affected in medial medullary syndrome. So this is how we need to approach the syndrome, guys. We don't have to mug up the brainstem sections and what is present over there. It's a process. Just we gradually have to build toward that. We need to understand the nerves and the nuclei and then other part of the brainstem, and then it makes a lot of sense to understand the brainstem syndromes. We'll reach there eventually. Second column, SVE column. The column is for what? It is for the pharyngeal arches. Pharyngeal arches, the muscle derived for pharyngeal arches. Mandibular nerve, nerve for the first arch. Facial nerve, nerve for the second arch. Glossopharyngeal, vagus, and 11th nerve collectively they have a common nucleus, and that is called as nucleus ambiguous. Nucleus ambiguous. I already told you about 11th nerve. 11th nerve, the cranial accessory nerve, it supplies the muscles of palate and pharynx, but not directly. It is supplying by the help of vagus. GVE column, general visceral efferent. It is for the smooth muscles and gland. Now, I hope you to just without looking into notes, just try to recall this, guys. Edinger-Westphal nucleus. What is a nerve for Edinger-Westphal? It is a third nerve. Third nerve is a nerve for Edinger-Westphal nucleus. And then Edinger-Westphal nucleus via third nerve will go and supply what muscle? Sphincter pupillae and ciliaris muscle. Superior salivatory nucleus. What is a nerve for superior salivatory nucleus? It is a facial nerve. Superior salivatory nucleus via facial nerve is going to supply all the glands except parotid. So submandibular, sublingual, lacrimal, nasal gland, all are by superior salivatory nucleus only. Again, don't go for the name of the nuclei. Inferior salivatory nucleus, inferior salivatory, guys, inferior salivatory nucleus, it is a nucleus which is present below, but it is supplying what? Parotid gland. Which nerve? Ninth nerve. Dorsal nucleus of vagus. The name itself says dorsal nucleus of vagus. So it's a vagal nerve nucleus. So vagal nerve nucleus, obviously the vagus nerve will come out of it, and then that vagus nerve will go and supply the smooth muscles and glands in the thorax also, and in the abdomen also, the thorax and abdomen as well. Coming to afferent column, the GVA, the SVA. GVA and SVA, both GVA and SVA, they have a collectively one nucleus, and that nucleus is called as nucleus of tractus solitarius. The nucleus of tractus solitarius. This nucleus is receiving the taste sensation in the cranial most part and is receiving the general sensation in the caudal part. That is nucleus of tractus solitarius. Then we have the GSA column. The GSA column, guys, this column, which is the one of the the biggest nuclei that you see in the brainstem here. And this trigeminal nuclei, the trigeminal nuclei having three parts. Mesencephalic nucleus present in the midbrain will receive the proprioception. Principal sensory nucleus will receive the touch and pressure. Spinal nucleus, which is extending till the C2 level, will receive pain and temperature. Predominantly receives pain and temperature, but it also receives the touch and pressure in the cranial part. Also receives touch and pressure in the cranial part. We already know the speciality here. The mesencephalic nucleus is a site for pseudo-unipolar neuron, and it is a center for what reflex? The jaw reflex also. And then we have a SSA column. Lastly, the SSA column is having what nuclei only? Vestibular and cochlear nuclei, which are present at the pontomedullary junction. They are situated at the pontomedullary junction. The nerve there inside, more. There could be more nerves inside here. But their first nerve is also there, second nerve is also there. But the nuclei, only vestibular and cochlear nuclei will come under this SSA column. Okay, so this is about the cranial nuclei in the column, and I told you that this is a kind of topic. The more you'll read further, you'll understand the previous part better. Now, we'll discuss the cranial nerves, and you will realize that how these cranial nerves are connected to them. Now, let me do one thing for you. Let me put a table here, a chart here, and that we will fill up this chart later, and you'll see that okay, how these columns are related to these nerves here, and you will see that. Okay, so basically, what I'm trying to say here. If I write all these columns like this, once again, the G, S, E, SVE in that sequence only, the GVE, the GVA, the SVA, the GSA, and SSA. I know it's at the first go, it looks like how we're gonna remember them. You will. This will happen automatically. As I said, the more you keep on discussing the cranial nerves, this will come into your head here. Now these are the columns we have. Now we need to see, guys, what nerves are related to what columns. What nerves are related to what columns here, right? Okay, like I'll give you the I'll first I'll not give you the explanation behind that. I will give you the explanation while discussing the nerves. But I'm just telling that which nerves are connected to what nuclei. Now, if I talk about the first nerve, the olfactory nerve, first nerve, guys, we're talking about the nerves here. The first nerve. Now it is connected to what? SSA column. Nerve, and we said the column is what? SSA. So the only check here is a SSA column. Second nerve, again, the only column there is SSA column. The first nerve and second nerve, the SSA column. No other column is there. Then we have the third nerve. Now, oculomotor nerve, if I take you back to the picture, you will understand that oculomotor nerve is having two columns. Now, guys, look at this picture here. The third nerve, you will see where you have a third nucleus present in the GAC column. So, one column is GAC because it is supplying extraocular muscle. And Edinger-Westphal is also the nucleus for third nerve only. You know, Edinger-Westphal third nerve is going from that. That means because of Edinger-Westphal, GVE is also there. The nucleus for is a column for third nerve. So there are two columns for third nerve. This one and this one. That's GSE and GVE. So let's come back here. So for the third nerve, it is a GSE. That's the first one. This one and the GVE. These two columns are there. Fourth nerve, fourth cranial nerve. Well, guys, fourth nerve, it only supplies the superior oblique muscle. That's it. The first column only, the GAC column, extraocular muscle. That's the only thing we have in the fourth column, fourth nerve. Then we have fifth nerve. Let's go in a sequence here. Fifth nerve, the trigeminal nerve. Let me take you back again. If you look at this picture, the trigeminal nerve mentioned is twice. We twice mentioned about the trigeminal nerve. One is here. It's a motor nucleus of mandibular nerve. So that's a trigeminal only. That's a motor nucleus. And this is a sensory nucleus, guys. Trigeminal nerve is a mixed nerve. So that's a motor nucleus and that's a sensory nucleus. So what are the columns? The column is SVE and GSA. So the two columns here is the SVE column and the GSA column. So the two columns here is a SVE column, pharyngeal arch column, right? That is one SVE column, and GSA column is there. GSA column is also there. line so that there is no confusion here. Okay. Then moving on, the next one is what? Sixth nerve, abducen nerve. Abducen nerve. Again, guys, abducen nerve is supplying just the lateral rectus muscle, nothing much. So GAC column is there. It is supplying extraocular muscle, the GAC column is there. Although some author believes that the sixth nerve also receives the proprioception. So you may see in some books GSA column is also mentioned. In some books they have mentioned this only this column. Some books they have mentioned this column also, GSA column. But I'm not going to go with that here because it's a motor nerve. So sixth nerve, mainly the function is to carry is to supply the lateral rectus muscle. But as I said, some author even believes that it is receiving the proprioception from lateral rectus. Okay. Then we have the seventh nerve. Now look at this, guys. Seventh, eighth, ninth, and 10th. Now let me tell you something about the seventh nerve, ninth nerve, and 10th nerve. Now I will not be able to explain this thing to you right now. We will discuss this later on. But seventh nerve, ninth nerve, and 10th nerve. Seventh, ninth, and 10th. I'm sorry. I'm bad with Roman numbers, right? Seventh nerve, ninth nerve, and the 10th nerve. There's something common about them. The common is that they are the nerve which are having loads and loads of function. अभी देखो seventh nerve is supplying glands also, carrying taste sensation also, supplying lacrimal gland also, supplying submandibular gland also. So many functions are there. So what are the columns related to them? The easy way is seventh, ninth, and 10th nerve are related to all the columns except first and last. How, what, when, we'll discuss that. Don't worry about that. So all I'm saying is that we have this one, this one, this one, and this one. All these columns are there. So five columns are there. Not only these, for the ninth nerve also, and for the 10th nerve also. How come? We will discuss that. But this is something to remember, that the 7th, ninth, and 10th nerve, they have all the columns except first and last. Except first and last, all the columns are there. Well, in your exam also, nobody is going to ask you the reason for that, but I still will discuss the reason. I will tell you the reason that why these columns are there. But because of the variety of function they have, so leave the first column, leave the last column, and all other columns are there. Because when the question is asked to you, they ask you a question like this. Okay, which of the given columns are related to 7th nerve? Then you have to pick and choose. It's easy. You remember which is not there. First one is not there, GAC is not there, the last one is not there, SS is not there, all of them are there. So for 7th, ninth, and 10th nerve, all columns are there except first and last. Don't forget this statement, this is really helpful. All columns are there except first and last. Reason we will discuss. Eighth nerve, guys, you know the eighth nuclei, vestibulocochlear nuclei. So once again, it is a SSA column. Eighth nerve is having SSA, special somatic afferent. Eighth nerve is having a special somatic afferent. Then we have 11th nerve and the 12th nerve. 11th and the 12th nerve. 11th and the 12th nerve. Okay. Now, you may see a couple of surprises there, especially in the 11th nerve. Guys, 11th nerve is related to two columns. The one column that you can obviously make out when you look at this, once again, this table here, 11th nerve is visible where? It is visible here, nucleus ambiguous. So because of this, obviously SVE column is there. But let me tell you, even GSE column is also there here. Because spinal accessory nerve, it supplies the sternocleidomastoid and trapezius muscle. And that is the one which will come into it here. So we'll discuss that, guys. We'll discuss that how exactly it is there. But just know that the first column and the second column both are there for the 11th now. Now I still need to justify why first column is there. So wait for it. First column and last column is there. First column and the second column is there. And 12th nerve, hypoglossal nerve, guys. Hypoglossal nerve supplies only tongue muscles, and that is again the GSE column, the first column. Hypoglossal nerve, only first column is there. So this is to tell you that which nerves are related to what columns here. The most commonly asked nerve from this, like from this here, would be the parasympathetic nerve. So third nerve, seventh nerve, ninth nerve, and tenth nerve is their usually favorite question. So third, seventh, ninth, and tenth, because these are parasympathetic nerve. Because they are parasympathetic in nature, so that's why they are more commonly asked, relatively more commonly asked. 3, 7, 9, and 10 here. So we just saw that columns, we understood what nuclei are there, we saw which nerves are connected to which columns here, although I still have to justify that why these nerves are there in these columns, which I will do it for you. But this is about the cranial nuclei and the column for now. Okay. Well, guys, I think I should take a break at this point here because we need to start with the next new topic after this. We'll start with the cranial nerves. So I don't want to start at this point. So take this 30 minutes break. Actually, I'll give you 30 minutes break. This break I'm giving it a little longer here. And when we'll come back, we'll start with the cranial nerves. We'll start with the third nerve and then we'll go further in that. So just find out some time in between, apart from having your coffee or tea, and just find out some time to just also to go through these cranial nuclei, and that will definitely help you understand the nerves even better, right? So I will catch you in 30 minutes from now exactly. And please do let me know in your group, in your Telegram group, that if it is going fine and you're able to understand everything. It is the feedback, it's the most important thing.